Thank you so much for stopping by today.
It's my pleasure.
Great. Give us your name, title, and organization. And if you want to say a little bit about the organization, that's fine also.
Okay, my name's Dr. Rick Sheff, Principal and Chief Medical Officer for the Greeley Company. We are a healthcare solutions organization. In a given 3-year period, we work with roughly 700 hospitals and healthcare systems across the country, from large academic medical centers and the largest healthcare systems in the country down to critical access hospitals in every state and every type of market. And the work we do really falls into 3 buckets. One of them I'd call hospital operations, a lot of work in compliance, CMS and other regulatory compliance, process improvement and simplification, patient safety. A lot of our work is in the physician space or the physician hospital space, beginning with the self-governed organized medical staff and now all the buzzwords of physician-hospital collaboration, alignment, and integration. And then in credentialing, we do everything soup to nuts up to and including outsourcing, business process outsourcing of medical staff services departments.
You're a busy man.
You know, healthcare needs a lot of help today.
Isn't that the truth?
Yes.
What excites you most about healthcare? What really kind of turns you on right now?
Well, I think we are in a really critical time in healthcare now. And the term that I most find exciting is clinical transformation. We've done clinical integration. We are now transitioning one of our Greeley National Seminars to do a lot of leadership training, especially for physicians. And we've had one to train physicians to lead clinical integration. Next week, we're having our first iteration of training physicians to lead clinical transformation. So to us, those are really 3 things that fit in that clinical transformation. One, we're moving to the second curve. We've got to figure out how do we move from pay for volume to pay for value, pay for population health. And it's all really driven by the need to improve quality and reduce cost at a pace and a magnitude we don't yet know how to do. But clinical transformation is where it needs to go. Part of that solution set, once we get out of pay for volume and pay for population health, it's going to allow us to open up the toolbox to include things that are going to address what we'll call psychosocial issues that are the real barriers and determinants of healthcare. So we look at CHF readmissions, we got to make sure they take their medications, but we also have to deal with their families, their self-esteem, their psychosocial needs, their economic needs, their transportation needs, and suddenly the healthcare system says, well, that's part of the business model for a change. Now we can really do transformational work to help those patients and their families. And the third is it's really leading to a reconfiguring of the space between physicians and hospitals. That's been a very troubled space. Trust is low, a lot of conflict, incentives aren't aligned, and it's causing us to rethink that and look for new solution sets, and that's a very exciting area that we work in now.
That's great. How about the reverse of that question? What kind of keeps you up at night? What are you worried about?
Well, I'll tell you what I'm worried about. I actually put it in the title of the talk I give at our plenary session. What we're doing in healthcare is not sustainable. The tagline is, will you be part of the solution or part of the problem? Because what we are doing in healthcare is not sustainable. So we've really got to change that. And I think there are 3 core elements that are not sustainable here that need to be tackled. The first is to recognize that healthcare is a scarce resource. And our duty is to figure out a fair, just, and equitable way to allocate that across our population. But we don't think that way. As a doctor, I wasn't trained that way. Healthcare systems aren't thinking that way. Politicians aren't going to get elected saying that to their constituents.
Right.
But it's true. And so we have to start treating healthcare like a scarce resource and find better ways to fairly, equitably, and effectively allocate it across our population. The second is what I'll call the part-whole challenge. So every part in healthcare, whether they're doctors, hospitals, healthcare systems, the insurance companies, the pharmaceutical companies, the IT providers, you name it, everybody in healthcare, the attorneys, the consultants, we are all acting in a way that we think is the right way to act. It's in our perceived self-interest, and we think it's a way to solve whatever the problem is we're dealing with, and collectively, we're creating something that's not sustainable. We're driving healthcare towards a wall of truly ugly proportions. And so we now have to start thinking not just about our part, but about the whole. How do we, and it's not to the exclusion of the success of the parts, the whole won't succeed if the parts don't succeed.
Exactly.
Getting a better balance of what's it going to take for my part to succeed and for the whole to succeed, and going at every issue with that thought will be really important. Because if everyone focuses just on their part, that's what worries me.
Right.
The third part that worries me is we talk about the triple aim. We are now beginning to talk about the quadruple aim, because the fourth leg of this stool that's going to be critical is what we'll call provider resilience. So that we are expecting a lot out of doctors, a lot out of hospitals, a lot out of healthcare systems, and we're putting a lot of stress on all of them. And they're not resilient. Physician burnout is high, right. Hospitals are going bankrupt, can't afford to do what we're doing. We have to find a way to get the provider side to develop resilience to deal with all the changes that are buffeting us.
Those are great answers, well thought out.
Thank you.
That's great. What do you enjoy most about your career and what you do?
Well, I'm a family doc. I went into medicine to heal and to teach. And through a career path I could never have designed, as now principal and chief medical officer of a healthcare solutions firm working with hundreds and hundreds of hospitals and healthcare systems across the country, I find myself still doing what I went into medicine to do, to heal and to teach, to come into these organizations. The organizations are hurting, people in those organizations are hurting, and they're trying to figure out, how do we do what we went into healthcare to do? And we get to, frankly, we do two things. One, we see if there's a best practice out there and we help our clients implement it. And if there's not, then we get the best and the brightest in the field together, develop a new best practice, and then help our clients implement it. And that's exciting and gratifying work.
That's wonderful. Have a bucket list?
Do I have a bucket list? You know, at this point, I've had a pretty creative life, and I'm quite happy with everything I've done. I don't think there's much left that I have to do, but I'm always open to what the next adventure is.
That's great. Great to talk to you today. Hope you have a wonderful meeting here.
Thank you very much, Dan.
You bet. Thank you.
Take care.